Nigeria has one of the highest number of maternal deaths in the world. A BBC report once called it the world's worst country to give birth. But this is not the reality across every part of the country. In the southern states, for example, the numbers are generally lower than in the northern states, where there are higher risks. A greater disparity is also seen between local governments in the said states and communities within this said local government due to several factors. This is why national average like this is not reliable enough. They tell us there is a problem, but they don't tell us where, why, or what exactly is going wrong. Three things that if we know, we can actively prevent a lot of these deaths. I've been thinking about this too, and I came up with an idea. What if there was an AI system? We just feed it a scrupulous amount of data on maternal mortality, and it identifies major factors contributing to it, and predicts the risks of maternal mortality per region, per state, per person, blah blah blah, which I rightfully called Save the Mother, or STM for short. But I wish it was that easy. The baseline STM model was trained on dummy datasets based on this criteria as a proof of concept. For the model itself, I used the Soft Voting Ensemble architecture of 4 complementary algorithms, which is basically me taking these 4 algorithms, putting them together, and giving them different voting power based on the decision they make. Now, they are categorized based on their level of performance. Now, due to class imbalances in my data, I had to smooth out the data, and I used a bunch of these other techniques too in the training of my model. Now, this is my performance metric. If you don't know the meaning of this, it's okay. It just means my model is doing good. The app itself comes with a bunch of tools like the Data Explorer, which allows you to browse and filter through the data set. You can check the factors that causes really high risk level. You see a CAPTCHA is one of them, postpartum hemorrhage. Then you can also classify this on geopolitical zones like say South, General Insights page that provides a comparative analysis across all of the Nigerian states and zones. Like you see, it categorizes the states based on the maternal mortality rates and provide other plots to help better understand the scale of things within each state and compare them to each other. The risks prediction page, which you could use to predict the risks per individual. You could use this to predict the risks per individual region, and you could use this to predict the risks like a bunch of data sets that you have collected in a CSV file. You just upload it here. You can use it to predict the risks for all of them at once. The policy recommendation page, which provides data-driven recommendations for health program planners and policy makers. You see this priority of states for intervention. They are categorized based on the data set. Then we have for replacing for us for no Adamawa. These are evidence-based recommendations, things to improve on that would actively reduce the rate of maternal mortality in the country. And one really good thing about this model is that it actively retrains itself. Once the data set is updated over time, it actively retrains itself to better understand the local context of things. In the future, I see this becoming an invaluable tool in health tracking and surveillance systems, shaping intervention programs and policies with data-driven insights. This project was built as part of my knowledge showcase in the 3MTT program under the pillar Digital Inclusion. Shout out to my ALC, Brain Builders IT firm.
So, did you know